Hi everybody, it's Dr. David Gustitis again talking to you about solutions for low back pain. One of the very important approaches that we take here at Rhythm of Life Chiropractic is we incorporate rehabilitation procedures. We want to make sure that after we adjust the spine, that we work with the soft tissue, the ligaments and the muscles that have become trained and have grown into a pattern, a habit pattern if you will, around that given alignment that you came in with. So if we know what normal is, we know that if your spine is over here and here's where we're trying to get, we need to work with the soft tissues, the muscles, and the ligaments that are also connected to that spine to help them to incorporate a newer configuration, a newer alignment that is more symmetrical and with proper curvatures overall. Now, when we start off though, you know that your spine is going to be really stiff, it's going to be stuck, it's going to be resistant to making those changes. So we start off gently with some exercises, some movements to get the spine warmed up. And once we get the spine warmed up, we incorporate traction. And the traction for this spine, for example, if it was done on this table for a brand new patient, especially one with a lot of low back pain, say they've got some disc involvement, this patient's going to lay on their back. And we're going to start off with just a baby wedge. This wedge right here is pediatric size, basically the size for a child's neck. We can put that on the low back and utilize that to help to open up the discs in this region of the spine. Right now, this patient, if they have a fairly straight lumbar spine, they don't have the proper curvatures from the side, we need to incorporate some movement in this direction to allow that area to open up. We need to allow some breathing in that area to happen, meaning those discs need to open up, expand, compress, expand, compress. We do some of that with the warm-up, but now when they're laying on their back, they're going to do a lot of opening up, a lot of extension and decompression when they're on this wedge. That's going to separate those vertebrae and allow some blood to come into that area, also allowing some water to rehydrate those discs. More of that will happen with movement following the traction, but it's really important that that area starts to open up in terms of proper curvature, proper alignment for that region. The ligaments are really what we target here on the traction table. As the patient is more able to tolerate a bigger wedge, we can incorporate a bigger block. There are some patients who really need to go the other direction. Some patients come in and their curvature is so extreme that we need to soften that curvature. So based on normal, if the lumbar curvature should be approximately 40 degrees, then let's say they came in with a 50-degree curve. We need to work on dialing that back if in fact that's where they need to go. Some people, 50 is closer to normal for them, and so we need to honor that, and that would be evident based off our analysis. But if that person with a 50-degree curve has more than what would be normal for their spine, then we can work with softening that and bringing some reduction in that curvature for that region. So we would do something different. We can remove a block on this table and have them laying on their back. Bring this block over here. We can have them lay on their back, and gravity and or a strap can help pull this area down, which would be like a stretch. So imagine an area that's stiff. With that pulling of the strap, it's going to stretch that area and open it up more in the direction that it's not moving. It's always very important that we move at the pace of the patient, so we're not trying to overload the spine or the person with forces or stretches that they're not ready for. We make sure they're warmed up. We want to make sure that the patients know that being hydrated is very important. So making sure that those soft tissues are hydrated will make them stretch more like warm taffy instead of cold taffy. If you think about cold taffy, it breaks. We don't want that. We want to make sure that the spine and the attachments to that spine are ready to bend, stretch, and open up and increase the range of motion, especially in the direction of alignment. This is one strategy out of many that we incorporate here at Rhythm of Life Chiropractic. We see patients coming over here with issues like spondylolisthesis, which is when one vertebra has now shifted and separated from the one that's below it and is shifted forward from that vertebra, because often there's a fracture of the vertebra itself causing a separation, and that takes the spine above it forward with it. Now, if that's happening at, say, L5 or L4, we want to allow that area a chance to move back towards alignment and then work with the soft tissue strengthening around it. We see great results with those patients. It's a difficult case. It's a difficult type of situation. We want to help that patient avoid surgery if at all possible. Same goes for the patients with the disc herniations, with the disc bulges. We might need to get an MRI. We might need to get a consultation with a surgeon. But as much as possible, we want to avoid those invasive procedures like surgery, and certainly the risk of needing medications like opioids that can be highly addictive. So whatever we can do to help to restore alignment, restore health to the spine, that's what we want to do. We do it here without drugs, without surgery, just the body healing itself. So if you're interested in learning more about how we can approach the solutions to your health problems, please click below and let us know how. We'd love to see you here at the office.